infusions of levodopa for Parkinson's disease have been around for many years, and it actually started here in Uppsala, in Sweden, in the early 90s, when the development of the levodopa carbidopa intestinal gel was started. And it has been approved in several countries nowadays, and so we're really gaining lots of information from different countries in the world. And now during the last years also there has been another jejunal infusion of levodopa containing also entacapone. So it's a COMT inhibitor within the gel. So there are now 2 marketed jejunal levodopa infusions. And the word jejunal, by the way, is, you need to get the medication into the small intestine. So either duodenum or jejunum. But if you would give it as a gastric infusion to the stomach, it wouldn't work that well, because the whole idea behind it is that you infuse the medication where it is absorbed. So therefore, you get these smooth and continuous levodopa levels, which we have measured in plasma in several studies. Also, this therapy needs quite a lot of resources around the team around the patient. For example, you need the gastroenteral access to the patient. So you need a gastroenterologist or a radiologist or a surgeon to get the PEG system in place. And we also know now that long-term experience with these treatments is very long in terms of the levodopa carbidopa intestinal gel. I think the world record is in one of our patients who used it for 23 years. And now the newer gel with the entacapone in it, there we have the world record of 4 years now here in Sweden. So because it recently started. The typical candidates for jejunal infusions are patients who have motor fluctuations. That's the indications for these treatments. Of course, there may also usually be non-motor fluctuations, but to be following the indications of the SMPCs, then it's motor fluctuations and dyskinesias. So the whole idea is to get this continuous dopaminergic stimulation, which is the aim for almost all the dopaminergic therapy. So if the patient is fluctuating, if the patient also can tolerate the system, has not had any previous upper intestinal surgery, then any patients with Parkinson's disease in a fluctuation phase are eligible for the therapy. Then some patients have reacted to entacapone with diarrhea, so that's the most common risk when entacapone is in gel. And for those patients, then the ordinary levodopa carbidopa is better. The main challenge with these therapies is the access to the small intestine. So the PEG system with a jejunal extension tube in it can cause problems, of course, mainly local problems around the skin irritation and so on. Previously, we had lots of problems with dislocation of the tube, so that the intestinal tube went back to the stomach. That's not very common anymore, but of course it can happen still. So such tubing problems are the most common ones. But once they are under control, the side effects from the medication itself is just like taking tablets. And in general, I would say a bit less side effects because we have this continuous way of delivery.